Assalamu alaikum, iyakan abdu iyakan astain. So from today's video I'm gonna start the medicine May papers. So let's start. Straight vessel, a long loop of Henle that helps in concentrating the urine, is the vasa recta. Excessive amount of the calcium in the extracellular compartment will come with the manifestation of systolic arrest. Next, earliest of all indicator of those calcium level in the body is the tetany. If 12-year-old boy, a 12-year-old boy breathing, what will happen to inhaled air in the alveoli? Increased air velocity progressively. Which of the following is a feature of associated with the Cushing's syndrome? There is a muscle wasting. Asthma effects. Which of the following the medium-sized bronchiole? Level of airborne in erect position is the C3. The main nerve supply to the trachea is the recurrent nerve. The preventing activation of the sodium channels increases the upstroke velocity of the action potential. The bronchopulmonary segments in the right lung are 10. The compression of the first lumbar vertebra will lead to the conus medullaris syndrome. The patient blindfolded asked to identify the structure in the hand. Which area assessment is being done? There is a somesthetic association area. The temperature 106 degree, humidity 10%, heat loss from the body will be through the convection. In hydrocephalus, which structure is most likely blocked? The aqueduct of Sylvius. A lady heard his husband saying that the neighbor loves her but don't confess, which further proves his secret love. The lady tried contacting the neighbor but he refused, making her sad. She is preoccupied with thought, sometimes get confused. That is definitely the delusion. Which of the following is detected by the peripheral chemoreceptor? That is decreased participation of oxygen. During cardiac cycle, the recording monitor will show V wave of the arterial pressure occurring in the isovolumetric relaxation phase. Next, 18, the factor for the exercising muscle blood supply is the local metabolic. During quiet breathing, expiration can be delayed due to the work of the abdominal muscles. Next, due to the severe stress, what will increase? There is the cortisol. C and K is positive in which of the following? The vasculitis. The small cell carcinoma is associated with the Cushing syndrome. Hypertensive can be managed pharmacologically in the surgical in the labs. What's the evidence that it makes it possible for him to treat it pharmacologically instead of surgically? That is hyperenemia. 26-year-old female presented the uncontrolled hypertension. There is a radiofemoral delay. Most likely cause of hypertension in this patient would be the coagulation of aorta. Which antibiotic interfere with the neuromuscular transmissions? There is minoglycoside, which is the following is the most common benign tumor. There is the Wathan tumor. Growth spurt at the puberty due to the factor released from the hypothalamus. Diabetic patient presented with the decreased visual acuity. Doctor performed retinal laser photocoagulation. It damages the outer layer of the retina. Patient presented with the rheumatic fever and endocarditis on discharge. The drug to be prescribed for the long-term treatment to prevent the recurrence would be the benzathine penicillin. The patient present dramatic fever, single dose of which drug should be given? The benzathine penicillin. A girl has the severe abdominal pain and the vomiting for 3 hours. The cause would be the enterotoxin. The carbon was given. This will work as initiated in the process. The initiator work as the DNA damage. Next, the child presented with the diarrhea, recurrent respiratory tract infections. There is history of the blood transfusion. The probable cause would be IgA deficiency. The best silence cause. Which of the following atonic bladder most common cause of the vaginal infection? The third trimester pregnancy would be the candida. A little girl having the menses. She saw some pieces coming the menstruations. She is very abortive, but could be the reason the sheds of endometrium. SMA switch to IMA. At which other falling place there is a transverse colon. Stab injury, the 6 intercostal space on the right side of the sternum will pass which of the following structures? There is the IVC. Next, the left renal vein drains into the IVC. Which part of the intestine does Entamoeba histolytica reside in? That is the cecum. The pregnant lady not taking fruits and the vegetables in her diet, her baby will be at the risk of the anencephaly. Plain nerve 9, 10 and 12 rise from the medulla. Singer's vocalis related muscle is which of the following? That is the thyroid retinoid. The woman had a polyp in the cervix. It was removed. In histopathology shows the portion of the polyp covered by the squamous epithelium. The change is the metaplasia. The group of the friend went to the restaurant, ate chickens and fried rice. At midnight, value the food poisoning. The causative agent is the Bacillus cereus. Which food is responsible? That is the fried rice. The female presented with the fever. Suburban pan pus in the urine, which is treated for 2 weeks. On culture, the urea is positive organism found growing in the chocolate agar. Most likely culprit is the Proteus. The diabetic patient presented the OPD with the oozing greenish discharge. That is going to be the Pseudomonas. Next, the newborn presented with the post-pneumonia infection. Sputum with a greenish tinge is seen. Causative agent is Escherichia coli. The dye injected in the patient shows the bilateral filling of the both ureters, but improper filling is in the renal pyramids, juxtaglomerular nephrons due to the urolithiasis. In atopic asthma, foreign substances reacts with the mast cells. The common features between the sarcoidosis and the TB is the granulomatous hepatitis. Next, baby at the 24-week respiratory distress syndrome, falling is correct regarding the condition that will collapse the patient with the values of these ABGs, that is the partially compensated respiratory acidosis. Hemophilia occurs in the male because the X-linked disorder. X chromosome in the male is hemizygous. The patient presented with the dysentery state, HP 5.6, specific hypoxia 96. The type of hypoxia is the anemic hypoxia. Type of hypoxia in which the oxygen can't be utilized by the tissue is a cyanide poisoning. Next, 58, the patient came in the ER with the chest pain. You see normal cardiac enzymes, normal doctor advice, thoracic cage, X-ray. Which one of these structures is cartilaginous and amphiarthrosis joint? That is the costochondral. The ischiopubic ramus fuse, at which age there is 7, is the transmigration neutrophils along the strong endothelium occurs to which module, that is PKM1. The neural delay is represented by the prolonged PR interval. The initially of the girl, you see tooth waves with the P waves in the ratio of 3:1. Her pulse is regularly irregular. Which of the following has occurred? That is the A flutter, arterial flutter. Next, the interventricular septum thickness, septum to free wall thickness 3:1. What is the cause? Is a hypertrophic cardiomyopathy, which why cimetidine in sacral phase should be administered at about 2 hours of gap in the patients with the peptic ulcer, because sacral phase inhibits the cimetidine absorption. The female with the severe abdominal pain diagnosed as a acute biliary colic, given morphine as analgesics, but additional drug besides morphine will provide good analgesia relief, that is hyoscine butyl bromide. Which of the following narcotic when given epidural cause the delayed respiratory depression? There is morphine. Patient after ingesting some eggs of the worms now present with the respiratory symptom. Organism most likely is the Ascaris. The 5 years after transplant surgery, malignancy is lymphoproliferative. GCPD common presentation is the acute intravascular hemolysis in the last trimester of pregnancy. What changes the respiratory parameters occur? The decrease FEV into FVC. Selective proteinuria greater than 3.5 gram/dl occurs in the minimal chain disease. The patient came in the emergency with the hypoglycemia coma. What findings will be? There is profuse sweating cells, and basophilia with the ribosomes. Anaerobic respiration, the RBC occurs in the cytoplasm. Next, the diagnosis of iron deficiency anemia is which of the following? There is a serum ferritin and the microcytosis. The microcytic hypochromia anemia, ferritin and the TLC at the normal. Confirmed investigation would be by the HbA2. The female with the HB, this one presented prescribed iron for the 2 months. She had the HB of 10.2. What should further consider for the diagnosis? That is HB electrophoresis. After how much HbA1c should be repeated made long to control the blood sugar? That is 3 months. The succinylcholine is used during the anesthesia skeletal muscle relaxation. It can cause a prolonged action in the individuals having the congenital because of the pseudocholine esterase. Next, the patient after chemotherapy has nausea and the vomiting. Which antiemetic will be given? That is the ondansetron. Patient was prescribed the antihypertensive captopril and atenolol presented with the complaint of cough, which has been done now. The stop captopril will be causing the cough in this case. The patient presented with the loss of taste sensation anterior 2/3 of the tongue, that is the lesion at the facial canal. The patient presented with the paralysis of the bilateral lower limbs in the lower half of the face, power 3/5 in the both limbs, homonymous heminopia along with the lost plantar reflexes. The lesion present in which of the following? The forebrain. A person after RT is unable to speak and has non-fluent speech but can understand the Kahn's lesion is in which of the following? That is the forebrain. Next, the patient can perform the supination of arm nerves. The supination include the musculocutaneous and the radial. The patient suffers CVA. He can't understand spoken words but can read words. Which areas in the medulla gluteal region? Injection site is the superolateral quadrant. Energy given at the superolateral quadrant to avoid the damage is the sciatic nerve. 30 years old woman is given 0.1 gram of insulin. 1 hour later, the plasma insulin concentration is 1 mg per 100 ml. So the following is the extracellular flood liters, that is 10. The cytoplasm was freeze fracture plasma lemma containing intramembrane particle, which is called as the P phase. The patient having the bleeding tendency in the diagnosis of one billion disease, which among the following tests used for specific diagnosis of one billion disease, that is increased BT. Next, 93. U wave in the ECG shows the pupillary muscle polarization to the following structures. There's the aortic dilatation compressed at the aortic hiatus. There is a azygis in the thoracic duct. The brain veins are tributaries of the diral venous sinuses. The damage to the ductal canal, which structure will be spot. That is obturator nerve. The major depressor of the mandible at the angle of mandible is the geniohyoid. Next, the about cardiac plexus contain both sympathetic and parasympathetic fibers. In mineralocorticoid excess antagonist act on which side as against aldosterone receptor. The mediator of the deep sleep is the serotonin. The CSL2 was given to a rat in the laboratory will lead to the hypocalcemia. Now, what will increase the 24-25 dihydroxycholecalciferol association of HLA-B5? That is the Beckett disease. The patient presented with the joint symptoms, low-grade fever, NA skin was done, and they was positive, and the anti-RNP antibody was positive as well. They are seen in the mixed connective tissue disorder. The baby presented with a microcephaly, microphthalmia, polydactyly, cleft lips, karyotype will be 47XY plus 13. Petrus syndrome. The supinator muscle is damaged. Now supination will be done with the help of the bicep brachii. The primordial germ cells are formed at the end of the third week. Lengthy scenario. Hypersensitivity reaction will be seen, that is the type 3 reaction, having hematuria, proteinurias, and abdominal pain. Buccal fat pads are absent and her eyes appear sunken. Serum ANA is positive too. The 15-year-old farmer, the history of chest pain, no other symptoms. X-ray was done which showed round mass which is calcified, that is aspergillus. The man with no cough and the fever, chest X-ray shows diffuse interstitial fibrosis. The likely diagnosis would be the inorganic dust. The colleagues complain about the 30-year-old woman who forges signs on important documents and search for the belongings of others in their absence, has joined another company and started smoking, has history of taking some drugs. What test would you do for psychiatric evaluation? That is a urine analysis for the drugs. Chi-square test associated with the 2x2 table. Next, 112, the child awake from sleep and starts walking. It is termed as the somnambulism. Next, the child presented with the dark urine and the homogeny state oxidase deficiency. What's likely cause? That is albuminuria. The gastrectomy performed 1 to 2 years back, now presented with the tingling sensation. Investigation MCV is 112. This is basically the pernicious anemia. The pregnant woman having history of the consumption of the fast foods presented with the anemia and raised MCV greater than 104. The most probable cause would be the folic acid deficiency. Next, 62-year-old patient of the cirrhosis presented with the edema, swelling in the legs. The mechanism of edema in the case of cirrhosis, which is the following: that decreased plasmochloride osmotic pressures. NMYC mutation is seen in the neuroblastoma. The patient has a low respiratory infection for many days. On histology, as respiratory tree, which of the following will be damaged? That is a Syria. The patient received the PPD. After 24 hours, she developed an irritated area along with the macrophages. Most likely will be the T lymphocytes. The patient went through a cystoscopy to the hematuria, later become unconscious, develop fever, and the hypotension. Cause of the hypotension in this case is the sepsis. The patient has the left side lesion in the brain. When examined, he was falling on the left side. Where is the lesion? There is a cerebellum. Which of the following is the memory immunoglobulin? That is IgG. The form cell in the atheroma is formed by the monocyte. The component of the neoplastic tissue include the seroma, blood vessel, the inflammatory cells. The patient having travelers diarrhea, not responding to antidiarrheals, drug should be given, that is the norfloxacin. Next is the local lymphatic obstruction is caused by the combination of two, which is the renal failure and the hyperproteinemias inherited only from the mother to the child is the mitochondrial DNA. The patient with the severe headache, vomiting, and neck stiffness, raised ICP and the lumbar puncture. There was blood stand CSF. Diagnosis is the subchondroid hemorrhage. The calcitonin is released from the parafollicular cell, which is not good for the heart, leading to the MI, that is LDL. The patient is on radiotherapy after that DNA damage. A gene with rest in the gene phase reprogression defective unregulated growth occurs due to the P53, the placenta attached but not penetrating through myometrium. That is the accreta. The pregnant female, the labor presented for 20 hours was admitted emergency and previous C-section, suddenly dies due to the amniotic fluid embolism. That is the acute cause of death. In this case, the patient with the alcoholic hepatitis with the medullary bodies, interwoven structures would be the intermediate filaments. The excitation contraction coupling in the muscle is by the calcium troponin C coupling. The patient liar. The aggressive can trickle things which can easily be recollected. Arguments which can easily be recollected. Area of the lesion with the prefrontal cortex. 55-year-old female with the family history of diabetes, have the fasting state of 156, 161 on occasion. She is asymptomatic. What should be done? The lifestyle modifications, and that is the weight reduction, diet control. SA node acts as a pacemaker of heart because of fact that generate impulses at the faster rate. Next, the tensor vela palatini is supplied by the mandibular branch of the trigeminal nerve, which is the following is true regarding gamma motor neurons. That is detect length change, which is the following is the cell of atopic asthma muscles. The osmosis depends on The number of the solid particles. The mineral of the bone is the hydroxy apatite. Histamine causes increase in the gastric acid secretion by the cyclic AMP mechanism. At ovulation, there is a rupture of graphene follicle, and if pregnancy doesn't happen, the leftover slogging of the corpora is the corpus hemorrhagicum. Next, the patient presents with the complaints of the burning epigastric pain on and off that improves after meals. This condition is due to the persistent release of the gastric acid by the presence of which of the following in the plasma: the gastrin. The patient has the cavernous sinus thrombosis. First sign will be the loss of abduction. Next, the patient has a history of disc herniation. The condition causes sensory loss by pressing on the posterior root. A drug causing the pupillary constriction, increased GIT secretions along with the bradycardia, the acetylcholine. The hypocalcemia is associated with the myocardial irritation. The smoker 40 smokers were included in the study on the cessation therapy. 20 volunteers were given therapy. At the end, calculated number of the cigarettes consumed by the 40 smokers, and noticed 40 patients were smoking 40 packs. What is missing in this study? The independent factor: the patient is terminally ill cancer patient with the bone mass is controlled by the given morphine. Pain is given controlled by the given morphine along with the following drugs to reduce the side effects. That is the paracetamol. Insulin dependent glucose uptake occurs in the exercising skeletal muscle. The patient came with the poisoning with the signs of opioid like poisoning. When given naloxone, the symptoms don't improve. What can be probable cause? That is the phantazoin. Which of the following occurs due to the parasympathetic stimulation? That is the bronchoconstriction. Which one releases the histamine? That is the vancomycin. In EKG, heart rate is 120 beats per minute and is related to the RR interval will be 0.5 seconds. The hard blow to the skull resulting in the depressed fracture with no splintering is most specifically called as the Pond fracture. Lubricant in the joints is produced by the synovial B. Sodium pressure pump is stimulated by the insulin. The patient has been given injection penicillin after we develops the short-term symptoms and the rash. It could be treated with IM epinephrine, but can directly induce the antibody response without helper T cell involvement. That is the bacterial lipopolysaccharide flagellin. 163, the emphysema decreases the lung compliance by causing destruction of the alveolar septa. During left ventricular failure, following occurs increase the pulmonary capillary pressure. Aortic pressure is highest at which phase of the cardiac cycle? Reduced ejection phase. The maximum pressure in the aorta is during the rapid ejection phase. Next, the inflammation, radiation cause injury by the reactive oxygen species. On initial patient interview, least likely thing to be done is the project an image of authority. Next, the brain damage after stroke. Which type of cells can be seen initiating a regeneration process? That is the protoplasmic astrocytes. On in utero study, it's revealed that there is a absent vagina and that receive the development of scrotum. Cause would be the testosterone producing tumors in the mother. Which of the following is involved in the pan-inhibitory pathway in the spinal cord in Raphe Magnus nucleus? That is the enkephalin. The type 2 renal tubular acidosis defect will be the bicarbonate deposition common to all types of the shocks. That is the tissue hypoxia. Next, S2 heart sound is shown on the JP, which right arterial waveform appear as the A wave. Which of the following disorder has PD sequence of the tryptones codons? That is the Fragile X syndrome. In female, femoral hernia, the structure femoral sheet is the femoral artery. Next, there is something hidden there. If the accommodation to something is intact and light reflex is absent, what will be the damage? That is the prefrontal area. Which bacteria have no cell wall? That is the mycoplasma. Loop dietic mechanism action on thick ascending loop of Henle would be inhibit the sodium potassium 2 chlorine pump. Initiation of the interdigestive myoelectric complexes is done by which hormone? That is the mostly in the pregnant lady with the 41 weeks 5 days pregnancy, anxious sequence for the induction of labor. Post-term pregnancy by the WHO, it is called as the 42 weeks completed. The slap cheek syndrome is called the single stranded DNA virus. The patient has the liver cirrhosis. Route of hepatic biopsy is the T10 mid XD line. The patient with the pyloric stenosis, the chronic vomiting, the most likely abnormality would be the hypokalemia. Nerve supply of the pericardium would be the phrenic nerve. The percentage of the water absorbed from the PCT is the 60 to 70%. The medial meniscus touches the knee through which ligament? That is the medial collateral. Next, the female is worried about the lump in her breast. She also has the family history of ovarian carcinoma in the mother. What is the main risk factor? That is the BRCA1. Increased ionized calcium indicates that is the parathyroid adenoma. Child not allowed on trip to take street food. He took food few hours later, developed abdominal cramps by the activation of the increased splanchnic sympathetic system. The patient had the citrate toxicity, underwent blood transfusion. After that, heart activity increased. Which vasopressor agent can be given in this case? That is epinephrine. Young female presenting the lethargic, bleeding, anemia, petechiae, and epistaxis. Best test for the diagnosis with the bone marrow biopsy. Last 193. What is true regarding the blood group antigens? That is glycoprotein. So that's all from this video. Thanks for watching my video. Do subscribe my channel. Until my next video.